Hey everyone, it's me, Cherie. I'm coming to you with an update. I know I haven't did a video in a while, but a lot has happened. A whole lot has happened. So I'm just gonna take you through pretty much, these past weeks of what happened. On February 28th, I had gotten my 5th treatment. I thought that I wouldn't have to take the chemo drug since, the PET scan came back that, the cancer was gone. She didn't stop it. She just lowered the dosage a lot, which I could tell a difference. She just lowered it real low, but she didn't stop it. So I went in that day, did the treatment, came out, went home. The next day, I had to get my new Neulasta shot, and then I had to do a bone injection, which, because the cancer was in my bone, it causes your bone in your body, if you was to hit it or something real hard, you can fracture your bone. So the bone injection just pretty much make you strengthen your bone. So I had to get, that was my first time getting that. So I had gotten that Friday, the next day after my treatment. After I left from there, I just wasn't feeling all that good. I was feeling kind of like feverish. So I went and picked up my daughter, came home, and I just hit the bed. I was just like, just don't feel good. And that Saturday, I just still wasn't feeling good. And, I'm thinking like, oh, this is very odd. Me not feeling good right after my treatment, because, usually I feel fine. It used to be like that Monday or that Tuesday is when I would start feeling, pretty bad and everything. So it was just like odd to me. And I called my mom that Saturday evening. Well, it was like Saturday, probably like 2 o'clock. And I was just like, I just need you. Just come. She was like, I'm at work. I was like, yeah, but I just need you to come home. I need you to come here to me. I just need you. And she was just like, okay, I'll see you when I'll be there shortly. And when she came, she checked my temperature and stuff. It was up to 102. Now, anytime you dealing with cancer and anything, they tell you any fever of 100.2, you need to call your doctor or, take something. But my fever was 102. And it just would not go down. So we went to the emergency room. Upon entering the emergency room, it was a doctor that was in the emergency room. I guess that was on call that day. And, told him, yeah, I had chemo and, I had this, and just not feeling good. I'm thinking it's just gonna give me something to break my fever, you know, and just keep a close watch on me. But, you know, he stated, oh, I work closely with the cancer specialist here. Usually when people come in with fevers, this is the antibiotics that we normally give, so I just give you the antibiotics. So he ordered the nurses to go ahead and give me the antibiotics. And then he came and took some cultures just to see what's going on. But first he started pumping me with antibiotics, 2 different kinds. And I'm just like, okay. But I still had the fever and everything, but the antibiotics was like coming quickly. Like he was pumping them in my body quickly. The next day, you know how you wake up in the morning and you know you have to pee, you know. The next day I'm just like, is there, you know, a nurse came in my room, I'm like, is there a reason why I haven't peed? Like, I haven't used the bathroom at all. And she was like, you haven't? I was like, no. Is there a reason? And she was like, no, I don't know. She's like, well, let me, you know, have them to check your bladder, do an ultrasound on your bladder. And we're going to draw some blood. They brought the ultrasound, they did the ultrasound. I don't know the outcome. I guess it was okay of my bladder. But then when they did the blood, they sent the doctor in the next day. And she was like, hi, you know. This doctor was very, she talked to me, put it like that. She was very attentive and she gave me the real. And she was like, hey, you know, your kidneys failed. And I was like, what? And she was like, well, you had a little bit of pneumonia. Just a little bit. Because I was like, you know, I'm like, hold on. You tell her, say, hold on. Now. I said, now I had pneumonia. She was like, yeah. She said, you just had a little bit. Not much at all, just a little bit. But the antibiotics that the doctor in the emergency room started giving you caused your kidneys to shut down. So your kidneys are not working. And I was like, well, what? She's like, your kidneys are not working. The antibiotics that he gave you, that it caused your kidneys to shut down. So we're going to take you, we're going to remove you from this hospital and take you to the hospital uptown Charlotte, because that's where the kidney specialists are. And, you know, then she left out the room. But in my mind, I'm like, I don't get it. You know, I come to the hospital for you to help me, and this is the protocol that I was told to follow. And now I done got worse. You know, I'm scared out my mind. I never knew anybody who went through kidney failure, or haven't talked to anybody with kidney failure, so I'm scared. So they loaded me up on a stretcher, sent me on an ambulance to the hospital uptown. And ever been to the hospital, you know that you feel like you don't get personal attention just because it's multiple people in there sick, you know. And you know, some of the nurses and everything, they just, it's like a job to them, you know. So they just don't care. Well, I wouldn't say don't care, but you know, a job, you know, after a while become a lot, you know, after some time. And I say when the first night I arrived to the hospital uptown, I could not eat anymore. No eating, no drinking, everything. I was throwing up. Could not keep down, not even water. Everything is so, you know, start messing with your mental. Everything start messing with your mental when you can't do anything small. You can't, like, eat or drink. Like, you would never think that you cannot do that. But when you can't, it start messing with you mentally. And I'm here in the hospital. Like, not knowing what's going on. And nobody is telling you, like, in detail what's going on or what's happening. Because, again, I'm clueless to what's going on. And sitting in there, my body is becoming weaker. I can barely walk, can barely clean myself, having accidents on myself. Could barely even wash my face. Then you start getting angry with yourself. Then you're trying to stay strong. It's a lot. It's a lot mentally. But then they started me on dialysis. While in the hospital, I did six dialysis, 6 treatments. It was a lot of fluid buildup. And I could tell that a lot was taken off. I lost tremendous weight because I have not been able to eat or drink. So with the dialysis, I had to put a catheter in my leg, in my groin. So I had to get surgery, get cut up and get that put in my artery. Then finally, you know, they looking at the numbers of the blood work. They see that it's doing good after dialysis and everything. Again, they say this is temporary, but you just don't feel those connections with the doctors while you're in the hospital. So they said that they can send me home. You know, still not able to eat or drink. Today is the first time I'm able to drink something, which is a smoothie. I don't know if this gonna come up or what, but this is the only thing I've been able to keep down so far. I'm trying to eat. It's so hard. Who would think it'd be hard to eat? No taste. No, just scary, just swallowing, just scary. But yeah, I got sent home, so I spent 17 days in the hospital. Telling you every thought in my mind, everything that you could think of. It's like, am I gonna die? Oh, Lord, I'm trying to fight this. Lord, what is it? Lord, just tell me. This is just every thought. Because you don't know what's going on. Today was supposed to be round 6 of the chemo. And that would have been the last time I would have to take the chemo. But she stopped it. Because she was like, my body already been beat up. So we didn't do it. I just went in for the, doctor visit and everything, and I'm just ready to be back normal again. Before they could release me to go home, I had to get a perm cap in me. So not only do I have the port for my chemo, but I had to draw blood today, so that's nothing. But I got the port put in my chest. I had to turn around and get catheter. Perm cap is what they call it for dialysis. So it's a big old tube. I had to cut my neck open. That skin glue. Stick it in my chest. It's like that wide. Can you see it? Then it goes down. It goes down the tube do. Then they have these two tubes, which is covered up because you had to keep it clean and stuff. So it's 2 tubes, 2 little vital things. So I have to walk around with this thing sticking out my chest. So let me see if I can take this off. Yeah, there it go. sticking out my chest. When I laugh or when I cough, it hurts. Well, not so much as laugh. It's when I cough or sneeze. It hurts because it's so huge. And it's in my head. It's so hard with being in pain. Not able to fix yourself, or I don't know. I look and I feel weird with these things in my chest. And the only thing I think about is like, I'm too young to be doing this. And Lord, what are you trying to teach me? What lesson am I trying? Do I need to get out of this? I'm an emotional wreck right now. But I know I'll be okay. I know I'll be fine. I know. I know in life that we try to rush things. This is teaching me to be patient. It's teaching me to watch the work of the Lord and what He's going to do in my life. But yeah, the main thing is patience, because everything is not a fast fix. So I know this video is all over the place. But I was just, wanted to, let y'all know what's going on. So, backtrack. The chemo had nothing to do with the kidney failure. The chemo drugs that I was getting does not affect the kidney at all. What caused my kidney to shut down was the antibiotics that the ER doctor pushed into my system without knowing why I had a fever first. So yeah, if you still using the chemo drugs, and it does not play, because I specifically asked cancer doctor that, did this have anything to do with, she was like, no. The research, the drugs that I have has no effect on your kidneys. And then there are some chemo drugs that do, but the one that I had nothing to do with kidneys at all. This was all because of the antibiotics. So if you have any questions or any advice or anything, just let me know. I know this video is crazy. I would try to come back with another one where my headspace is strong, but right now I just feel weak. But I will talk to you guys later. So, have any questions or comments, just leave them down below and I will answer. Have a good day, y'all. And please keep me in your prayers. Bye.